The World Health Organization says Ebola deaths could top 1 million by mid-January, tearing apart the social fabric in some countries and threatening the peace of mind in others.
I mean, what I've seen in Liberia is real hyper-awareness about Ebola. And there's a lot of fear around, and a lot of it is generated by the fact that there are not enough treatment beds available for people with the disease, and they know that if they get sick, there may not be a place for them to go.
International Medical Corps has built a treatment unit in Liberia and is constructing other facilities in both Liberia and Sierra Leone.
Here we have two countries, Sierra Leone and Liberia, who are coming back from the brink of civil war. And for them to be now dealing with Ebola on top of it, this crisis is a global crisis. Whatever resources it takes, we have to be there because it's going to continue to spread if we're not there, and it has to be stopped and contained at the source.
We finally arrive at the Bong County Ebola Treatment Unit. It's been set up by doctors from International Medical Corps.
4 hours by car, 2 miles on a muddy road through a leper colony to get treated.
And people do it because that's the only option they have.
This is a disease that transmits itself by body fluids, and there's nobody who spends more time with the body fluids of sick people than healthcare workers.
Your clinic's been open for a month. None of your healthcare workers has been infected.
Well, it's not entirely surprising because I think our staff have actually had more training than some staff would have in the United States because we're trained to do exactly what we're doing. This is all that we do here.
Ebola treatment units are being built as fast as possible. One of them is run by an American relief group, the International Medical Corps.
Dr. Colin Bucks has been on duty here for the past month. At home, he's an emergency physician at Stanford.
I think this is very containable. That's why I urge people to say this is my responsibility. I have a global citizen responsibility to do this, and a patriotic responsibility to keep America safe. Yeah, people go off to war to keep us safe. People should fight this crisis with the same sense of responsibility.
Even though I know it's a reality that I could get sick and that I could be one of them that doesn't survive, I'm okay with that because I'd rather be here helping than home and safe.
Most of the staff here are Liberian, and to lift their spirits, they mark every new shift with hymns. The stigma of the disease is so great, many of them say they're treated as outcasts when they commute back home every day. But in here, the Americans who work with them call them heroes.
When you look at the blue buildings and the PPE spacesuits, this is a little otherworldly. There are tons of sad stories, but there's also a lot of cured patients. Statistically, that's fewer than don't make it. But when it happens, it's just a thrill.
In West Africa, our troops, our scientists, our doctors, our nurses, our healthcare workers are rolling back Ebola, saving countless lives and stopping the spread of disease. I could not be prouder of them.
As Global Emergency Health Coordinator for the nonprofit International Medical Corps, Shetty is more typically found in health hotspots around the world.
To address this type of outbreak, we need to hit it hard, we need to hit it fast, and that's what we did from U.S. government, and International Medical Corps was one of these agencies, and that we responded as quickly as we can and as aggressively as we can. And because of that, I think we stemmed the tide of this entire outbreak.